Imagine the sun setting over the Nile, casting golden light across the marble halls of Alexandria. Cleopatra, the Queen of Egypt, draped in silk and jeweled adornments, prepares for a visitor who could change her world, Julius Caesar. But she doesn't rely on charm alone. Her servants have filled the room with the rich, intoxicating scents of jasmine, cinnamon, and rose. The air is heavy with fragrance, each note carefully chosen to calm, intrigue, and captivate. As Cleopatra glides gracefully into the room, Caesar is caught not just by her presence, but by the sensory spell she has woven. Aromatherapy, centuries before modern science, becomes her tool of influence, desire, and strategy. Centuries later, in the quiet countryside of Giverny, France, Claude Monet steps into his sunlit studio. The windows frame the vibrant colors of his gardens, and the air is alive with the subtle fragrances of lavender, rosemary, and chamomile. Each inhale calms his mind and sharpens his focus, turning fleeting impressions of light and color into the brushstrokes that would define Impressionism. Aromatherapy is not just luxury, it is inspiration, a creative force guiding genius. Then, in a 20th century French laboratory, René Maurice Gattefossé experiences aromatherapy in its most practical form. After a severe burn, he instinctively plunges his hand into lavender oil and discovers something remarkable. The pain eases, the skin heals faster, and infection is prevented. A single moment sparks a lifetime of exploration, turning centuries of aromatic tradition into the science of healing we recognize today. From the allure of Cleopatra to Monet's artistic genius to the clinical breakthrough of Gattefossé, aromatherapy has shaped desire, creativity, and medicine. And today, we're going to explore how it can support your mind and body, backed by science, not just legend. Hi, I'm Dr. Hanz Bustamante. Today, we're diving into aromatherapy, a centuries-old practice that may help reduce your reliance on pain medications and lower your risk of side effects. But first, a huge thank you to Dr. Mike and his incredible team. Being featured on their episode, Natural Cures That Actually Work, was a real honor. Their dedication to evidence-based natural medicine is something I deeply respect. If you're here from that episode, welcome. You've landed in the right place for simplified, science-backed medical insights. Stick around, because I've got some actionable recommendations coming your way. On Dr. Mike's channel, I briefly mentioned how aromatherapy can support pain management. Today, I'm going to unpack the science behind it. When we hear severe pain, most of us think strong meds, and sometimes that's necessary. But is it always the best first step? Look, if you're recovering from surgery, managing chronic pain, or dealing with a serious illness, pain suppression is very important. But at the same time, it is equally vital to calm and relax your body so it's in the best state to start healing itself. And this is where I've recommended a natural approach to many patients: aromatherapy. This isn't just about making your room smell nice. We're talking about concentrated plant-based compounds, essential oils that can influence the way your brain processes pain. This isn't fringe science. It's a supportive therapy for people dealing with acute and chronic pain, stress, and tension. The goal? Reduce the perception of pain, calm the nervous system, and when appropriate, help reduce the need for stronger medications. A 2016 meta-analysis published in Pain Research and Treatment reviewed over a dozen clinical trials and found that aromatherapy significantly reduced both pain intensity and anxiety across surgical, obstetric, and chronic pain settings. Scent-based interventions can have measurable effects on how the body experiences pain. Let's break down 3 essential oils with real therapeutic potential. 1. Lavender oil. You've probably heard that lavender promotes relaxation, but did you know inhaling it can also reduce your perception of pain? Studies show it acts on your central nervous system, calming anxiety, one of the biggest amplifiers of pain signals. And as we've heard from the story of Gattefossé earlier, it also helps heal minor burns and prevent infection. Number 2, peppermint oil. Peppermint oil is highly effective for tension headaches and muscle aches. Its key ingredient, menthol, provides a cooling, analgesic effect. When diluted and applied to your temples or sore muscles, it works like a mini ice pack in a bottle, soothing, refreshing, and fast-acting. 3. Chamomile oil. Chamomile essential oil contains compounds that reduce inflammation and promote muscle relaxation. It's a gentle soother, especially helpful when stress or physical tension is part of your pain picture. And I don't want to end this video without talking about a product that I personally use. It's called white flower oil, a staple in many Filipino homes. It is trusted for its soothing effects on headaches, nasal congestion, and minor aches. Its formula contains camphor, menthol, and methyl salicylate as active pain-relieving ingredients. To balance and enhance its scent and soothing power, it also includes eucalyptus oil, lavender oil, and peppermint oil. People commonly apply just a few drops to their temples, neck, or chest, or inhale it from a handkerchief to ease tension or clear stuffy sinuses. A quick word on safety. Essential oils are powerful tools. Aromatherapy works best as part of a broader pain management plan, not a replacement for proper medical care. Always consult your healthcare provider, especially if you have asthma, are pregnant, or have other conditions, before starting any new therapy. The mind and body communicate constantly. What the mind thinks, perceives, and experiences is sent from our brain to the rest of the body.